Follow-up care and health maintenance. Follow-up care is the most important factor to your weight loss success and future health. We must make sure that you are losing weight in a healthy way. We will discuss your protein and food intake, vitamin supplements, and exercise regime at all your appointments. We will also require periodic blood work to check your vitamins, protein, and blood count to ensure that you are not becoming vitamin or protein deficient or anemic. You will be seen several times in the first year after surgery. They are as follows: 7 to 14 days post-op, 4 to 6 weeks post-op, 3 months post-op, 6 months post-op, 12 months post-op, and then annually every year. We encourage patients and family members to attend a support group. Patients with good support systems have greater long-term success. Several support groups are offered at various locations. Information is available on our website at whyweight.com. Changes in hormone levels can happen in both men and women as you lose weight. Hormones are fat-soluble and can be influenced by body fat. As you lose body fat, the levels of hormones circulating in the body can shift. Patients may experience mood swings, irritability, depression, sadness, and changes in sex drive. These changes are usually temporary, but persistent problems may require treatment with medication and/or counseling. Women may experience irregular menses in response to surgery and changing hormones. If you experience prolonged vaginal bleeding lasting more than 5 days or larger amounts of bleeding, you should contact your gynecologist. Both men and women can experience changes in sexual drive. These reproductive hormones changes after weight loss surgery are temporary. Because of hormonal changes, many women experience increased fertility following bariatric surgery. Consult your gynecologist for effective birth control methods. It is recommended that women do not get pregnant in the first 12 to 18 months following weight loss surgery. If you do become pregnant, you should seek the care of a high-risk obstetrician or a maternal-fetal medicine specialist who can follow and advise you closely. For women who desire to become pregnant in the years following surgery, talk to your surgeon and obstetrician regarding vitamin levels and nutritional needs before becoming pregnant. Remember, women have higher needs for iron, protein, and calcium during pregnancy, and certain vitamins like folate are important to preventing birth defects. Constipation can occur at times in the months after surgery. To avoid this, we recommend an over-the-counter daily fiber supplement to maintain bowel regularity. purchase a powdered, unflavored fiber supplement such as Benefiber, Metamucil, or Citracel, and add 1 to 2 teaspoons to your liquids every day. Fiber needs water to work effectively, so increasing hydration is important. Increasing your intake of fibrous foods as you advance the diet is also important. Fibrous foods such as fruit, vegetables, and whole grains should be included. Some patients experience hair loss during the first few months following weight loss surgery. This hair loss is most often caused by physiological stressors such as rapid weight loss, hormone shifts, severe illness, and major surgery. These stressors will cause your active, growing hair follicles to become dormant and hair will fall out. This will usually resolve within a few months and the hair will begin to grow back. Deficiencies in iron, protein, and zinc can also worsen the degrees of hair loss. Thus, it is important to be compliant with your protein and vitamin supplementation and have your blood work monitored for deficiencies. In the years following surgery, there may be some symptoms that can indicate a long-term complication. You should be seen by a bariatric surgeon if you suffer from any of the following: abdominal or stomach pain, pain that worsens after eating, maroon, red, or dark sticky stools, nausea that lasts more than 2 days or keeps reoccurring, vomiting more than 4 times in a day or more than 2 consecutive days, change in the tolerance of normal consistency foods, acid reflux, especially at bedtime. Your bariatric surgeon is now your gastrointestinal specialist. As general surgeons, we are experts at esophageal, liver, gallbladder, appendix, stomach hernia, and intestinal surgery. When there is a medical or surgical problem or emergency related to your abdomen, stomach, or small intestines, a bariatric surgeon should always be consulted. If you are treated in an emergency room, hospitalized, or planning an abdominal surgery, a bariatric surgeon should always be called. There are specific conditions and symptoms related to bariatric surgery that may only be diagnosed or detected by a specialist with bariatric experience. If you are out of town or you cannot reach your surgeon, you should contact a bariatric surgeon in the area. Remember, you should take vitamin supplements for the rest of your life. You should always choose to eat protein-rich foods first. You should continue to have annual blood work to check for deficiencies and anemia and to ensure that you are healthy. If you relocate, we can help you establish with a new bariatric provider that can follow you. If you decide to see only your primary care physician, be sure to have your nutritional blood work checked annually. The following annual blood tests are recommended: CBC, CMP, magnesium, calcium or intact PTH, lipid panel, a hemoglobin A1C when indicated, vitamin B12, folate, whole blood thiamine or B1, iron levels, vitamin D25, vitamin A, zinc, and thyroid screen. In addition to an annual nutritional evaluation, remember to talk to your primary care physician about having routine screenings performed according to your specific needs and risks. Thank you.